Hello everyone, this is Rebecca, occupational therapist. This is Dementia Masters, where I teach you everything you need to know about dementia so you can master it yourself.
And in this short video, I'm going to show you how caregivers can help their loved ones reduce symptoms of dementia, reduce daily struggles, and reduce the rate of decline, while providing dignity and a sense of independence throughout the day, without arguments, extra medications, or caregiver burnout. Even if you've tried doctor's appointments, joining Facebook groups, looking stuff up online, or you've gone to physical or occupational therapy, and you still have gotten no real answers on what your loved one needs on a day-to-day basis. I'll show you what 99% of caregivers who are doing the best they can to keep their loved ones out of the nursing home and manage their daily needs are doing wrong, which causes your loved one to have increased confusion, increased frustration, and increased depression, which results in a more rapid rate of decline, increased safety concerns, and increased behaviors. And let's not forget, increased caregiver burnout. There is a better way. I'll show you exactly what to do instead with my simple Decoding Dementia program that anyone can use, even if you don't have a medical background, you're not living with your loved one, or you think things just can't change. Since you're here on this page, it means you're likely frustrated with the lack of information on exactly what to do with day-to-day challenges. You feel helpless watching your loved one struggle and not knowing how to help. You want to give your loved one a sense of independence, and you do not want to feel like you're following behind your loved one and telling them how to do everything. You need to know why a behavior is happening and how to stop it or prevent it the next time. You hate the idea of putting your loved one in a nursing home just to be neglected, and you dread wondering if there is a better way. And you're overwhelmed by the lack of support from family, friends, or the medical world. You're feeling lost and you want to scream, "I'm trying the best I can." Maybe you've tried making doctor's appointments. Their answer is medications that only dope up your loved one, with referrals to another specialist and still no education on day-to-day needs. Maybe you've gone to support groups and got limited answers to specific questions. Maybe you've looked up Facebook groups, only to find a lot of people complaining but no real answers. You're left feeling like you want to give up, but you know you can't. You just want your loved one to continue to be safe and happy and not struggle. And you don't want the disease to be the last thing you remember. You probably feel really guilty when you get aggravated, but you just don't know what's going on and how to respond. Pretty much, you want to know what is going on and how to provide that best support. You want to feel proud you were able to give your loved one purpose and support during this time in their life. You struggle watching your loved one deteriorate and change. Ultimately, you're desperate for answers to everyday challenges. Imagine if you had the right tools to provide a positive and engaging day while limiting behaviors. Imagine if there was easy adaptive equipment out there that could make your loved one's day 10 times easier. Imagine if you could anticipate your loved one's needs. Imagine if there is an easier way to do things. Imagine if you could spend less time staying up all night listening for your loved one and more time feeling rested. Imagine if you didn't go to bed at night wondering if you can keep doing this, but go to bed proud telling yourself this was a good day. All this without having to waste time driving to another appointment, paying a copay, repeating yourself just to get minimal information and handouts. And without having people coming in and out of the house, not knowing who your loved one really is, and asking the same questions over and over again, causing more stress and confusion. You can take the steps to understanding the complexities of dementia. You can provide the best scientifically proven support you and your loved one really need. You can reduce caregiver burnout and create positive memories. You can give your loved one the feeling of purpose and personal independence throughout the day. With this information, you can teach everyone supporting your loved one so they too can provide the same positive support. If you are a caregiver who resonates with any of this, I know exactly how you feel. I have been an occupational therapist and a rehab director for over a decade. My work has focused on educating nursing homes, patients, and their families about the tools needed to understand dementia. Personally, I know exactly how you feel as well. I first saw both my grandmothers deal with Alzheimer's in my 20s, and I sure didn't know what to do then. Then I became an unexpected caregiver to my father in his 60s, suffering from diseases that caused dementia. It was my first year after graduating from college, and I thought I could handle caring for my father. I was working as an occupational therapist, so why wouldn't I know what to do? School taught me how to get the right equipment, make the house dementia safe, take his daily vitals, and get him to exercise. But I realized weeks in, I was wrong. Even to this day, I know I did things wrong. That was because it took 10 more years of specialized classes and working and learning from my patients and families. I was so overwhelmed with caring for myself, my job, and my dad's everyday needs. I was exhausted. I didn't realize caring for a loved one with dementia was truly a 24-hour job, physically and emotionally. I had poor sleep patterns because he got up and wandered around, which now I know is called sundowning. I stopped taking care of myself and I gained weight. I fought with my husband and my siblings. Some days my dad was all smiles. Other days he was lost, confused, mad, suspicious, or wanting a drink. Nobody at the time ever taught me what to say or do during these real moments of need. I tried doctor's appointments. They gave me medication to help calm him down, but it made him more confused and harder for me to care for him. I was embarrassed, but I asked other therapists and nurses what to do about his behaviors and randomness. Their mindset was for people in the nursing home. Give them exercise if they have declined, keep them on medication to keep them from getting up and around, and put the television on to keep them distracted. I have to say, this does not work. It causes increased depression, no purpose in the day, and a higher rate of decline. I was given a number to a social worker and she was helpful, but she only talked about different programs in the community and not had to deal with my dad's behaviors and real daily needs. Got home health therapy in, and they were good too, but they focused on home safety and physical progress, and still no real answers on resolving dementia behaviors. Every now and then, my dad would get sick and he'd end up in the hospital and then off to the nursing home. And all I saw him was doped up, in a wheelchair, and in a hallway, not engaging. And he was always 2 steps back when he got home. At the time, I never knew about all the different evidence-based therapies, how they helped engage and emotionally support a person with dementia and their symptoms while reducing behaviors. I was so lost there was no one real person that sat down with me and helped me understand what to say or do to limit anxiety, suspicion, or hallucinations. Nobody taught me how to get my dad to engage and give him a sense of independence and purpose throughout the day, which limited behaviors. There were times I felt so defeated, I would cry in the shower, watching him struggle and just wondering how I could keep doing this. I was angry with my brother. He would yell in frustration, trying to get my dad to understand, which just made his behaviors worse. And since I was working, I also had a hard time keeping people at the house to care for him and for them to understand my dad's needs. At times, my dad would call me at work telling me nobody was feeding him, which resulted in me spending exhausting time convincing him he had eaten. I have to say, for people in the healthcare industry, you would think that they'd be more understanding, but eventually, with all the distractions, I had to take a medical leave of absence, and eventually I lost my job. I had to stay on my toes all the time, trying to reduce his anxiety and behaviors, and trying to give answers to things that weren't really happening. I know now, with simple tools and understanding, I could have provided so much more support and created a better day for everyone. After his passing, I continued working in nursing homes. I saw families ask the same questions I had and staff struggling with behaviors. I knew there had to be something different. I knew if I had a hard time, then everyone else is having a hard time as well. Fast forward years of certifications and learning all the different evidence-based therapies that really help people who are dealing with dementia symptoms. I created a simple Decoding Dementia program for patients, families, and staff. After a year of implementing these strategies, 2 years in a row, the nursing home was awarded 5 stars for reduced falls and anti-anxiety medication. They had increased staff and family satisfaction, and perhaps most fulfilling of all, they had increased patient participation, personal engagement, and reduced behaviors. And my success can ultimately be boiled down to my simple Decoding Dementia program. When COVID hit, the nursing homes, all my hard work went down the drain. People were left isolated, staff was inconsistent, and therapy was the last priority. I knew I had to bring my program to people who heard the horrifying things about nursing homes and wanted to keep their loved ones home but didn't know what to do. 3 common mistakes with dementia care, because without fixing these mistakes, no step-by-step process in the world will solve your problems. Mistake number 1, the nursing home is better equipped than you. Please don't think that. Don't think anybody's better than you. The nursing home is not better equipped. The nursing home costs about $15,000 a month, and that's sharing a room with a stranger. And they have minimum staff requirements. Like in Massachusetts, for every 25 patients, there's 1 CNA, and in Texas, the rule is up to the nursing home. So they have no rule. And since COVID, staffing is at record lows and turnover is really high, limiting personal attention and understanding of your loved one's needs. There's a higher level of neglect, higher levels of medication usage, and a quicker decline. And some states don't even require dementia education, while others require about 2 hours a year. Versus care at home, there's decreased medication, decreased depression, decreased spending, and less worry about abuse and neglect. And there's increased levels of engagement, higher level of attention, increased personal autonomy, increased memories, and a lower rate of decline. By learning and understanding dementia, you can feel better knowing that you can do a better job than paying a nursing home $15,000 a month and worrying about depression, neglect, and a quicker decline. Mistake number 2 is that you cannot limit or stop behaviors. You can limit and stop behaviors by understanding what dementia does to the brain and using easy strategies to assess what's going on. For example, I'm going to tell you a couple stories of some people that I've worked with. Beth is a woman who contacted me because she had brought her mom into her home from a couple states away and started taking care of her. And her mom just kept going to the door and trying to get out. She would go to the windows and always be peeking out the windows. And Beth was worried about her mom. She learned and looked up all the things she needed to look up by trying to provide distractions, by giving her movie nights, trying to keep the door closed. She even put the couch in front of the door. But all this did was get her mom angry. Her mom would be angry and yell at her and not make the situation any easier. And so after I worked with Mary and Beth, we were able to assess why her mom was trying to leave. We were able to create a dementia-safe environment with adaptive equipment. We were able to implement specific activities to reduce sundowning, wandering, and her behaviors. And Mary's daughter was so relieved she knew what to do throughout the day, what to say, and how to react to reduce the behaviors. She told me the days were so much smoother, and now they are able to create better memories. So you can limit and stop behaviors. And another thing that you can do is remember that a behavior is a reaction or a form of communication. So I was going to tell you about Mike and his parents. Mike contacted me because his father had just come from the nursing home, and after a fall from getting the mail, and he was diagnosed with vascular dementia. And Mike did see that his father was declining, but didn't know what to do, and his mom was helping, so it wasn't that big of a deal. But Bob and his wife just kept fighting all the time, and he kept refusing to shower. So she had to call in Mike and ask him, to come in and help his dad with a shower and try to do something about it. And Mike wasn't able to do anything about it. His father refused him. And so after going through my program, Mike learned how to communicate at his father's current level and was able to assess why he was refusing. And I was able to suggest adaptive equipment to change up the bathroom, change the communication style to get him to agree, ways to communicate to the steps needed to complete the shower, and still giving him a sense of independence and reducing his anger. And Bob and his wife were still arguing about little things. Mike was able to teach his mom better ways to communicate and understand and assess why Bob was angry at the times. And Mike told me his father still gets angry at times, but is able to assess the situation and figure out what is going on. He was also able to teach the CNA how to say things and do things to get Bob to participate more. And we have to remember that dementia is not just about losing memory, but it's about misconnections in the brain. Bob had lost his ability to communicate effectively, causing angry outbursts. Bob felt embarrassed about what was going on with him, and Bob was depressed, losing his independence. The dementia symptoms Bob had were causing changes in his balance, his vision, taste, controlling emotions, physical abilities, and much more. So dementia is not just about losing memory, it's about losing a lot more than just memory. My next example of being able to stop or limit behaviors is if you can assess what's going on and you know what your loved one's history is about, you can communicate and limit behaviors from happening. So I'm going to tell you about Evelyn. Evelyn was in the nursing home and she kept getting up and down all times of the hours, forgetting her walker, looking around the nursing home, looking around in other people's rooms, drawers, everywhere. She wouldn't sit long for meals and she would refuse any activities and she refused to come to therapy with me. And everybody was afraid she was going to fall. She ended up coming to the nursing home because her son was afraid she was going to fall, and she was up getting around and she was falling at home. So for me, I was going around with her, and one day her son showed up, and finally I was telling him what we were doing. I was trying to figure out what she was doing, moving around and looking for something. And he asked her, "Ma, what you doing?" And she said, "I'm looking for Stan." And he said, "Stan's dead, don't you remember?" And at that point, I didn't know who Stan was because I didn't know anything about her history. And her son went on to tell me about how Stan was a son that she had had before he was even born and had passed away before he was even born. And at the time when he said, "Don't you remember?" she looked up at him and was very angry and said, "Who are you? Get out of here," and just kept pushing and swishing him out of her room. And you could see that he was hurt by the situation and didn't know what to do. And for the rest of the day, she was upset. She refused to do anything. She just kept mumbling and just was not happy. So the next session that I saw her, I had gotten a doll, a male doll, and I put it into one of the chairs that she usually went around and peeked around with. So she found the doll and she just was so happy to find the doll, and she said, "Oh, I found Stan," and she was happy and delighted. And we were able to put a basket in front of the walker, and she started using the walker. She started going to therapy sessions. She was able to go to meals and sit with meals, and this gave her a purpose. And it was great. After knowing Evelyn's personal history, I was able to create a safe environment, adaptive strategies, limit anxiety and behaviors, and increase participation. And the thing with the doll is that sometimes, I gotta say, she would look up at me and say, "Stan's really a doll." And I wouldn't know what to say, but she kept going with it and she enjoyed the doll. So one of my biggest things that I could tell you is helping your loved ones stay in the moment that may not be real to us, but it's real to them, is key to lowering to their stress and their anxiety and their behaviors. So Evelyn's son came to a support group, and I discussed with him about understanding about being in the moment with his mom. And we also implemented more strategies that he could use to create memories and help his mother recognize him the next time. And he was so thankful for this information because at first he was against any type of thing making his mother feel immature, but he saw how happy she was in the moment and how she was moving around with the walker. And so that part is the most important. And one of my biggest sayings is, if it's not physically or mentally hurting them, or others, then let them be happy. Let them be where they are and let them be happy. The next mistake that we seem to have is that we think sometimes that they are doing this on purpose. And I'm going to tell you a case study about myself and my father. And I had plenty of these, but here's one incident that I'm going to tell you about. My brother had found a friend who could cover some hours when I was at work. She didn't know much about dementia, but she took care of her mom in the past, so this is what I needed. And I got a frantic call from my brother, freaking out, telling me that I had to get home and that he couldn't handle my dad and that everyone was yelling. And my brother said that my dad was being a pervert and that the CNA, or the person he had hired, wanted to quit. And so I came home to them yelling at each other, and I couldn't figure out what was going on until we all calmed down. And what had happened is that the caregiver, she had found my father, peeing in the sink. She found his pants around his ankles and his things out, and he was peeing all over the sink and the ground. And she just thought he was being a pervert and wanted to get out as quick as possible. And after everybody calmed down, I was able to assess that my father was doing. He was looking for where the bathroom was. He was looking for what was going on. I had moved his stuff downstairs in his house that he had lived in for over 36 years. And so his bathroom was in a different area than he was used to. I brought his bed downstairs and I made a bathroom out of a closet. And it did the job, and I would bring him to the bathroom and I walked him. But when I left him with the caregiver, I didn't explain to her that this might be a new environment for him because it had been months. I put the commode at the end of his bed and I put a urinal attached to his side rail, so I figured things would be fine. And at the time, that wasn't. The mistakes that I had made is that I didn't change his living area to be dementia friendly. I should have told the caregiver about his environment had changed, and I should have put up adaptive strategies like signs around the place or something that would have helped direct him to the bathroom. But I didn't know these things. And my father's behavior was not being a pervert or doing it on purpose. He had urgency. His history included bladder cancer, so his urgency was really urgency. And he didn't want to have an accident and be put back into what I call hospital underwear, he called diapers. And he didn't want to go on the floor. So I say almost kudos for him. He was figuring out where he could go, and that's where he ended up. And if I had known these things, I would not have had to deal with another stressful moment. My brother would have been more tolerant and willing to help. My father would have not been upset with himself and everyone else, and I would have been able to keep the help that I had. So, now if you're making any of these common mistakes, and if you want to get real answers to daily dementia challenges, and you want to provide a calm and supportive environment, you're probably wondering what you should be doing instead of arguments, questioning, and medications, and what this Decoding Dementia program is all about. And most importantly, how will my simple strategies work for you and your unique situation? Well, you're actually seeing this page at a very opportune moment.
I so appreciate you taking the time to be with me today. I hope you've gained some valuable insights. If you couldn't tell by this presentation, I completely understand the challenges you face when caring for a loved one with dementia. I can't actually say completely because every person with dementia and every family and everything is always different. Everybody's different. But it's not just a job. It's a commitment that requires immense love, patience, and understanding. As you've learned, I've worked many years caring for people between nursing homes, home health, one-on-one private consultations, to watching both my grandmothers with Alzheimer's and caring for my father with dementia. I have definitely seen a lot. I have so much information you don't even know that you need yet. I know some of you are thinking, well, I already know what's going on, or mom's not that bad yet, or things are never going to change anyways, or we're just taking it one day at a time. But the thing is, that's like saying, why do I have to take that math class? I'm not going to be an engineer. I'm not going to use this in real life. But we all know that we need this information later on in life, right? Down in the future. You have signed up to care for a human being who has a disease that affects their memory, their personality, and their abilities. They need your support and understanding to continue to enjoy life, feel purposeful, and not feel like they're a burden. If you have not heard me say this before, it's one of my most famous quotes, and I feel like it says everything that we can say, is that your loved one with dementia is not giving you a hard time. They are having a hard time. They may not look like they are, but they are having a hard time just spitting out the right word or thinking of the right thing, or understanding that it's not real or that it is real. All that type of stuff. They're having a hard time. If this was any other disease, and if it was your child or your loved one had, we would learn as much as we could about it and try to provide the best support. For some reason, people have dementia and they go, oh, it's just old age, and it's not. There's a big difference. The average life expectancy of someone with Alzheimer's is 8 to 10 years, and it can be much longer depending on other health risks. My uncle right now, he's a super healthy person, but he is starting to start with Alzheimer's. So, he's still out jogging and doing what he needs to do. So, but the brain will deteriorate, not the body, while the body deteriorates later as well. So I'm telling you, you really want to invest in understanding the complexities of dementia to make life more enjoyable for you and your loved one. If you don't, you'll end up burning yourself out and giving up. And you don't want to give up. And it hurts inside of the feeling of wanting to give up. One of the primary reasons a person with dementia ends up in a nursing home is because the caregiver gives up and feels burnt out and is overwhelmed. And it's understandable, but if you learn about dementia, it can be a little bit easier. So this results in thousands of dollars a month spent in nursing homes. It's crazy how much people spend, along with a great amount of neglect and depression. And so enough with my speech. I'm going to talk about how I can help you. I'm excited to bring my very first course called Decoding Dementia. This is a comprehensive 8-week program designed to give you the knowledge, tools, and support you need at a fraction of the cost of individual consultations and nursing home care, or wasting your time going to the doctor, asking questions in front of your loved one, and getting very limited information. And quite honestly, they've done reviews, and there's like 1 in 4 doctors actually understands what to say about dementia and what to say. They feel uncomfortable. They don't even know what they're doing. They're a general practitioner. Anyways, so I'm making this group experience. I'm making this program a group experience, allowing us to connect, learn, and grow together. And believe me, the doctor's office is not going to do that. Wouldn't it be great to know what might happen next and be prepared and listen to how others have gone through the same thing, and being able to see what they did and learn from others' mistakes and their wins. Since this is my first course, I'm focusing on helping you gain the most important insights I believe will be helpful. Because believe me, I've been thinking about doing like a 3-month course, but I want to, reduce it first at the beginning. But as I grow, you'll have access to future videos and classes. The course will primarily focus on understanding dementia, taking a deep dive into how dementia affects the brain and behavior, managing day-to-day challenges, learning practical strategies for handling behaviors like wandering, agitation, and refusals, and many others, hallucinations, sundowning, all that type of stuff. And how to break down the activity. Breaking down daily activities and tasks allows your loved one to have personal independence and dignity. So you're not just doing it for them all the time, but you're helping them feel like they're still doing something. And helping them finding purpose. We all need to feel like we have purpose when a debilitating disease takes away our ability to complete things on our own. The feeling of purpose is diminished and depression and behaviors take over. So we all live off of our daily tasks. We want to feel like we've provided a purpose. We're happy when we help someone, or at least I am. You will gain insight on various therapeutic interventions that can reduce the rate of decline and reduce common behaviors. You'll learn about adaptive equipment, which is great tools that can help with maintaining some independence and dignity, and help with home safety and reducing behaviors, and kind of, help with bathing and help with dressing and help with a lot of things. There's a lot of things out there that I can tell you about. So also creating structured routines. We're going to learn about the importance of routines and how they enhance your loved one's daily life and reduce behaviors. And then we're going to really focus on you, managing caregiver stress and burnout, which is providing like essential tips on recognizing when you have burnout, which I'm sure you know when you have burnout, but practicing self-care and finding that help. I know a lot of people think my loved one isn't going to take any help, or I don't need any help right now. It's so important to start as early as you can, because as some of you know, the less help you have, the more overwhelmed you will become, because the disease will become more demanding. Also, your loved one will become more demanding and feel less comfortable being with somebody and new people. So if you start them early on this whole entire journey, they will adapt and learn and be more comfortable having more people in the house or going off to doing things. So all of this is with a holistic personal understanding of your physical and mental needs, because believe me, I was very burnt out, as you've heard. I'm starting with small groups and asking for your feedback and answering your questions. I'm going to have everything recorded just in case you miss it or you need to review again. I want you to digest and try to implement some strategies, and then come back at the end of the week and send in questions, and I'll have some answers where I can address your specific concerns. So technically you'll have like 2 hours a week of me. I know it can be a commitment, but everything is recorded and accessible for your time. And you'll never, I don't know, I've never seen a program where you'll get 2 hours of an occupational therapist that has real life experience and can give you real life advice. And there'll be a private platform where you can share experiences, ask questions, and have a community support group. There'll be a library to access the downloadable guides and the planning tools. So you may be wondering who this is for. This is for caretakers and professionals trying to find solutions to everyday challenges and want to provide a supportive environment to a person who really needs you right now. They're depending on you. This is my first time offering a course like this. Because of that, I'm offering it at an incredibly low price. Just $157 for the full 8 weeks, which is less than $20 a week. That's apparently less than going to McDonald's. Or $24 a week if you prefer to do pay as you go, so you can cancel anytime. I know things happen, so it's just important. This price is only available for the first time. As I gather feedback and make the course better in the future, the course evolves and the price will go up, obviously. And as I said before, you will have access to any new videos and new information as I grow. So if you've been waiting for the right moment to invest in your own learning and in the care of your loved one, this moment is now. I can help almost anyone. This is your chance to get in on the ground floor, be part of this supportive community, and help shape the future of this program. So I want you to click on the button below to secure your spot. I'm making my group small for the initial course. I'm gonna do a couple different days or times where we can get together, because I know some people like mornings, some people might want afternoons, some people live over the pond. So I want everybody to have times where they can meet with me and feel like they're part of the group. So we will create that together. And we're gonna start in a couple weeks. So I want to get on the ground, I wanna get rolling, and I think this is all important. And I just want to help you. So if you've been struggling to make caregiving easier, have you been needing to get answers to everyday challenges for a while now? You've got to do something different. You have to do something different. You can't just go back to distractions and arguments. You can't go back to thinking this is the only way, because it's not the only way. If you understand something and you learn something, you're like, aha. If you we prepare for our retirement, we prepare for our jobs. You have to prepare for dementia. You certainly can't go back to wanting to give up each day. So I am here to help. I want to do this full time for you guys. So this is what I really want to do. You can finally feel like you can truly understand what your loved one with dementia needs and provide the right support. So I want you to click on the button right now and sign up for the course. Don't miss this opportunity. Thank you so much, and I really appreciate your time. If you have any questions, you can reach out to dementiamasters@gmail.com. If you really needed to, we can make an appointment where we can talk. I know it's hard to make appointments, so just figured, if you reach out to me with Gmail, we can come up with a time, or I could just tell you some answers. And I'll see you on the other side. I really hope you guys are wanting and willing to do this course, because I'm really excited about it. So have a nice day and keep up the good work. And I'll talk to you guys soon. Bye.